Hello guys, welcome back to another video. My name is Cynthia and I am a YouTuber based in Toronto, Canada. Today's vlog is just going to be very educative because I've decided to do more videos about my field. I know my vlogs are mostly about lifestyles, but I decided to add this because this is also part of my life because I'm a healthcare professional. I will start making health videos talking about health situations, health illnesses, and so many things that a lot of people don't know and need answers to. I'm just going to be explaining stuff and then using layman languages, so I'm not going to use the medical terms so nobody gets confused. I'm just going to explain it in a way that everybody would understand. Anybody watching this video will just hear and understand. The topic for today would be peptic ulcer disease. If this is something you're interested in, or you know someone who has ulcer and you're wondering how it happened so you can prevent it for yourself, please just keep watching. I will be back.
You melt the ice,
but a lot of people are suffering from ulcer. I know more than 15 people that has ulcer, and I am just here to give a brief explanation of ulcer, the causes and the treatments, and also the prevention. And I know a lot of people are wondering how come there's no ulcer in my family. I mean, it's not hereditary though, but like some people can be like, my mommy doesn't have, my daddy doesn't have, why do I have? Why do you have? I'm about to tell you why you have. So that's just it. And don't think it's a bad thing. It's not a death sentence, and trust me, it is curable. Okay, there are some that are not, but majority of ulcers are curable. You just have to know what caused it and then you tackle the cause. You understand? So yeah, peptic ulcer disease, there are like two types. So that's the duodenal and the gastric. The gastric is more severe and mostly occurs in elderly people, in middle-aged older people. Okay, so the gastric is more severe, and we take it serious because some of the causes might be malignant, so we take that one serious. But for the duodenal, it occurs in young adults like us, young adults. So there are so many causes of ulcer. Number one cause of ulcer is a bacterial infection. This bacteria is called H. pylori. We get it from saliva, food, contaminated water, mostly. That's where the bacteria is gotten from. Okay, another cause for peptic ulcer is NSAIDs. So NSAIDs are medications. So just listen. Oh, you can be taking one medication that is causing your ulcer, you don't even know. Yeah, so these NSAIDs, the job of that medicine, apart from pain, because the NSAIDs are pain medication, so apart from pain, apart from helping you with your pain management, the medication also does something that prevents, I don't want to go deep, but the medication prevents, your stomach has linings, things that protect them, things that suit them. So that medication prevents your body from producing the enzymes that helps to suit your stomach, that helps to cover the lining of your stomach. So once you keep taking that medication all the time, since it's preventing that enzyme that helps to cover your stomach and cover the lining of your stomach, your stomach will be exposed. So that way you get your ulcer. Does it make sense? I hope it makes sense because I don't know how else to say it. Yeah, so this medication, NSAIDs, example, ibuprofen, diclofenac, which is very common. Everybody takes, oh, my head is aching me, take diclofenac. Oh, and people take diclofenac for 2-3 weeks and you don't want to have ulcer. Please, how? You're going to have ulcer, okay? So that medication is not something you just take and keep taking. If you're going to take an NSAID, you need to time yourself, maybe for a week or 2 weeks maximum. Or if you're going to take it for a longer time, there are some medications you add to it that would cover that effect that it's causing to your stomach. So yeah, NSAIDs. And then another cause is the inability of your body to produce the excessive production of gastric acids. So if your body is producing gastric acid too much, you can get ulcer. Okay, so yeah, that's like basically the summary of how ulcer is. So just imagine you have a cut on your hand, the wound there, and water keeps touching it, salt, pepper, seasonings it will be paining you. So that's just how it is. So the ulcer pain is usually at the epigastric region, so just little below your breast if you're a woman, and then if you're a man, you know where the breast is. Yeah, around there, that's where the pain is, like that's where it comes. So I'm now going to the signs and symptoms. So the symptoms, these are the things you would present yourself with. These are the things you start noticing about yourself if you have ulcer. Okay, so the symptoms are pain, like I said, severe abdominal pain. Sometimes it could be all over your stomach. It's not just that place. Sometimes you might not even have the pain there. So it differs with people, but generalized abdominal pain, and then in most cases you have that epigastric pain, which is that pain right below your breast, the middle of your chest, right below your breast. So another symptom, if it's caused by that infection we are talking about, you'll be having fever. Sometimes you'll be vomiting. So how do I even put it? The main symptom that almost anybody with ulcer presents with is stomach pain. So once you're having stomach pain that's unexplainable, like you've checked, you've seen that you didn't eat any bad food recently, nothing, it's just there, and it's sometimes the ulcer pain even wakes you up at night. When you're hungry, the hunger and the pain wakes you up. So that's to let you know that it's severe. So like I said, epigastric pain, abdominal tenderness, abdominal pain like everywhere. in duodenal, this pain is aggravated. Duodenal is usually aggravated by hunger. So that's why when you're sick, when you're having that kind of pain, the doctor will ask you, when do you feel this pain? Does it come when you're hungry? Do you understand? Then he's trying to look for the particular type. Okay, why gastric? That one is caused by food. Once you eat, it picks up. Duodenal is not caused by, the pain is not aggravated by food. That one is even when you're hungry, you feel the pain. But the other one is when you eat, you feel the pain. So that's like the difference, okay? So when you get to the hospital, there are some tests the doctor will run. The doctor will do some stool examination, which is to check your stool for that bacteria. Like I said, that bacteria, you can get it from contaminated food, water, and saliva. Mixture of your saliva with a contaminated saliva, and you can get that infection. So yeah, the doctor will check it. There's something called endoscopy, where they put like a camera down that would go down and check, and they'll be seen inside there, and they will see it. That's just another, they will see that injury, they'll see that sore there in your stomach. That's just another way of them diagnosing your ulcer. Another test that they usually do all the time is full blood count, like just a general hemoglobin test, just to check if there's an ongoing infection in your body, because remember, once it's caused by the bacteria, there will be infection. it's an infection, so most of the time your white blood cells will be very high, and then that's another way for them to know, okay, your own is caused by this this infection, not the drug or not any other type. So know this and know peace. So for the treatment, I'm just going to start telling you about the non-pharmacological treatments, which are the treatments that does not involve medicine, that does not involve drug. Number one, stop taking alcohol and smoking, because those taking alcohol and smoking just helps, it just aggravates the pain. Okay, and even if you're trying to heal and you constantly consume alcohol, the healing process will be, will be delayed, and it might not even heal if you keep taking. So till you're completely healed, you stay away from alcohol or smoking. Another non-pharmacological treatment is stop eating food that aggravates the pain. Some people love eating pepper. People like me, I love pepper with anything living in me. Even my husband always complains. Yeah. So, but once you've noticed that you have ulcer, you stop eating pepper. Not because the pepper is causing the ulcer, no, but just so that you can heal and then you can go back to your normal diet. But for that time, you have to stop eating anything that aggravates the pain. Some people, once they take oily food, they feel the pain. So stop eating oily food. Okay, so that's just how it is. Another non-pharmacological treatment is you stop the drug. So if you're part of the people that are taking NSAIDs and you've been taking it for long and you realize this is what you're feeling, even without the diagnosis, you just realize that you're feeling this, you're feeling that, you're vomiting, you're having serious stomach pain, you don't know, just stop taking that NSAID. Okay, because that may 100% be the cause of your ulcer. Okay, yeah. And then if that's like the only medication you have for your pain, because normally NSAIDs are pain medication. Examples of NSAIDs are diclofenac, as I earlier said, ibuprofen. I know a lot of people are taking those too. So if you're taking them and that's like the only medication you have for your pain, you have to go to your doctor. He's going to add something. He's either going to change the medication, saying that it's already causing ulcer, or he's going to add another medication to you that you'll be taking together with that NSAID, so that one will block the NSAID inside there from acting on your stomach. Okay, yeah. To pharmacological treatments, which is like the most important, you see, because once ulcer is not treated properly, it will reoccur. So and I feel like, not that I'm an expert, but I feel like that's where a lot of doctors make mistake. They don't tackle, like, you see, when you find out the disease, you hold it by the neck and cut it. Yeah, they don't do that. They just bend the neck and need to straighten up again. But if you get what I'm saying, so the treatment is really very important. And then you as a patient, the treatment is very important. You need to stick to your medications and make sure that you have taken them completely for you to get better, so it doesn't reoccur. Okay, so let's start with, if they finally found out that the cause of your ulcer is from NSAID, those medication. Okay, apart from stopping the medication, there's something called antacids. So anti-acid, that is just what it means, but we call it antacid. So anti-acid meaning no acid. I don't know, anti-acid, yeah, no acid. So like I said earlier, one of the causes of ulcer is excessive acid secretion. So these anti-acid are going to neutralize the stomach acidity. So if your stomach is producing plenty acid, the job of that antacid is to neutralize it. So it is now going to help with your ulcer. help. So you have to take it. Some people prescribe it for a period of 2 weeks. Some people prescribe it for 1 week. It just depends on the doctor's, judgment. Yeah, and another thing, trust your doctor. I mean, he's a doctor for a reason, right? So trust their judgment. So antacid, it just neutralizes the acidity of your stomach. So if your stomach, like, let it produce a million amount of acid, the job of the antacid is to neutralize it. So it should be neutralized, and your ulcer symptoms will reduce and eventually heal. And then if they notice that your ulcer is not caused from drugs, it's caused from that bacteria, what's it called, H. pylori, Helicobacter pylori. So since it's an infection, you have to get antibiotics. Okay, that's where some health professional make mistake. They don't give antibiotics, they just give you the antacid and tell you you'll be fine. Yeah, the antacid will neutralize the stomach acidity. It will help you for a while, but that infection is still there, so it will reoccur. So a lot of people make a mistake by not giving you that antibiotics, which is what will kill the infection, and then the antacid will help, and everything will just heal, and gradually you get back to your normal self. So there are different what's it called, different antibiotics you can use, but I'm just going to give you my own formula. So it's called how do I even, you see, it's been long I practiced, so pardon me. 2020, 3 years now and I've not practiced, so pardon me. What's it called, Seth? The amoxicillin. And I mean, it has to be 2 different antibiotics. You can't use one. That's another thing. Some doctors will give you one. It will not really tackle it. It will just bend the neck. By the time you finish taking the antibiotics, the neck will straighten up and attack you again. And yeah, so 2 antibiotics. You can use the amoxicillin, you can use the metronidazole. When you use these 2 together with an antacid. So examples of antacids are omeprazole, esomeprazole, blah blah blah. So you can pick one antacid, then tackle it with the 2 antibiotics. You can use the metronidazole and amoxicillin. You do this for a period of 10 to 14 days. You take this medication for a period of 10 to 14 days. If you're using the amoxicillin, you can use amoxicillin 500 milligram. You take it 3 times daily. And then you use the metronidazole 400 milligram. You take it 3 times daily. You can take this medication for 10 to 14 days, and then added with the antacid, maybe omeprazole, and then trust me, give your ulcer 2 weeks, even before 2 weeks, but you're supposed to take the medication for like 2 weeks. Give your ulcer that 2 weeks, you get better, and this will prevent the reoccurrence. If you don't mix antibiotics with it, if you just give antacid, you see that you get better for a while, and give yourself few days or few weeks, and then it comes back and it might be worse. Okay, so as a doctor, once you notice that your patient is getting fine and everything is resolved, you've done your part. If there's any form of bleeding, please don't go to your pastors. Go to this hospital for them to refer you to a surgeon, because it means it is beyond medication. It needs good repair. Okay, I hope you guys enjoyed this talk. Yeah, I'll be doing more of this kind of talks now, because I know a lot of people are slacking behind health-wise. So let me come and enlighten you on what to do and what not to do. Okay, and I hope I used good terms that you can relate to, good terms that are easily understandable. I hope so. Yeah, so let me know if you enjoyed this video. Give it a thumbs up, and don't forget to subscribe. I will see you guys in my next video. Bye. So yes guys, I'm back again. So we have this hat for kids, this beautiful hat for kids. This is going to help a lot with the summer and the sun. doing the summer activities. This is the black and white Dalmatian print. We also have another kind of black and white Dalmatian print, which you'll be seeing shortly. So yeah, this is the other type of black and white Dalmatian print. This is very good for the sun. Okay, get it for your kids. So we have this head warmer. I call it head warmer, some people call it baby cap, so whichever one you call it. Yeah, this is the yellow color. We have this is the cream color. We also have another color. Let me see here. Yeah, so this is the third color. It comes in several other colors, but these are just the samples that I am showing here. So any color you're interested in, just kindly send a WhatsApp message to the phone number at the end of this video, and we will respond, or just send us an email and we will respond. And then we have other designs like this. Yeah, so this design is, I think, just for girls. I don't think a boy mom will get this for her son. So this is just for girls. It comes in different colors. This is the pink, and then we have a yellow, and then it's very tight. The material is, you know, very solid. It can last you for a very long time. We also have the pink. Yeah, this is the baby pink. Like, it's so beautiful. Also, we have caps, face caps. These face caps are for kids, as I said earlier on, not for adults. It has a smiley emoji at the back, which is very symbolic for kids. Yeah, but it's very beautiful. This is the white. It comes in other colors, as you can see in the video. We have orange there, we have red, we have navy blue, we also have yellow, we have cream. Okay, so yeah, that's cream. We have yellow, so this is yellow. And then we also have black, which is coming right up. Yep, that's the black. And we have pink, baby pink too in it. Yeah, so different colors. I'm 100% sure that we have more other colors. These are just the samples I have here, so that's what I'm showing. But any color you have in mind, I would still be, you know, posting more updates about upcoming colors that are available. But these are the colors we have right now, and you can just place an order by sending a WhatsApp message to the number showing on your screen, and we'll get